Our next topic for discussion is aging. Aging is something that's going to happen to all of us sooner or later. We could summarize the changes that occur with aging, and sometimes I do that, and I simply say that everything begins to wear out, give out, slow down, hang down. And that sort of describes what happens with aging. But I think we'll get a little bit more specific as we do our discussion. First thing I'd like us to do is start with a question. A 72-year-old man is brought to the auditory clinic by his son, who reports that his father is having trouble hearing and seems to be a little depressed. The man says, quote, "There's no use worrying about a hearing aid. I don't have much time left and didn't use the time I had very well anyway. It's too late now to do any good," end quote. The nurse recognizes that his behavior indicates he may be struggling with 1. Identity versus identity confusion, 2. Generativity versus stagnation, 3. Intimacy versus isolation, or 4. Integrity versus despair. And the developmental task that is appropriate for this person, this aging person, is integrity versus despair. So now, and that's their task. I sometimes call it volunteerism versus rocking chair. In other words, they should be continuing to be active and a part of life and a part of the community, as opposed to simply sitting in the rocking chair as they get older. Now, just a quick review. What age group is identity versus identity confusion? That's adolescent. And the adolescent is all about me and mine. Who am I? What am I going to be when I grow up? The next one, age-wise, would be intimacy versus isolation, and that is your young adult. And that's all about us, and it's often the stage of marriage. As they get a little older, the middle adult is generativity versus stagnation. And this is when you find yourself running the show. So you are taking your child off to Cub Scouts and Girl Scouts, and you're leading the groups, and you are being a soccer mom or a soccer dad, and you are serving on infection control committees at work. In other words, in this stage of generativity, basically you're running things. Then as you get to retirement, you step back a bit in that integrity versus despair, but should still stay active. In the integrity versus despair stage, as we said, it's adjusting to retirement not only with less income for most people, but it also may mean that your circle of friends is less, because oftentimes people's social circle is related to their work environment. One of the things that could come up in questions on this is it all right for the patient who's getting older to talk about dying? And the answer is yes. It's a lot more real when you're 80 years old to think about death than it is when you're 20 or 30 years old. So letting patients talk about death is appropriate. If you take a look at this picture, you note grandmother and grandfather. Now, I want to ask you, which one demonstrates despair? That's right, grandfather demonstrates despair. Who would you rather be more like when you get older? Grandmother, because grandmother has a reason and a purpose for living. Let's take a look at some of the physical changes that occur with aging. If we take a look at those eye problems, so we'll start with glaucoma. We need to remember that not every aging patient gets glaucoma, but it's very common in aging. If you don't want glaucoma, don't get diabetes, and select your parents carefully, meaning that there is a hereditary component to glaucoma. Another common problem, but not universal problem with aging, is cataracts. If you don't want cataracts, wear sunglasses when you're out in the sun when you're young, don't get diabetes, and select your parents carefully, because there is a hereditary factor with cataracts. Another problem that is just about universal with aging is presbyopia. This is the farsightedness of aging, and you know when people have this, when their arms aren't long enough to read the newspaper, when they're putting reading glasses on the end of their nose, they stick them on their forehead and hanging around their neck. And presbyopia starts in the 40s usually. So this starts relatively young as far as aging changes are concerned. Other problems that can occur with aging, presbycusis, or the decreased hearing. Not all people lose their hearing as they get older, but many people do. Now, short-term memory loss. If they're going to lose their memory, it's short-term they're apt to lose. So they can remember what they wore at their 5th birthday party, but they can't remember what they had for breakfast. Now, the rest of the changes that we're going to look at are pretty much universal changes. We could summarize it by saying all the organ systems become less efficient. So as people age, the cardiac output is decreased. It doesn't always cause a problem, but it's usually decreased. There's some stiffening of the blood vessels, arteriosclerosis. Atherosclerosis, the plaque formation, is something you have a little more control over depending upon your diet and exercise patterns. Muscle atrophy is common but not universal. The basic rule is if you don't use it, you lose it. So if people continue to be active as they age, their muscle tone will stay better and they'll have less muscle atrophy. Osteoporosis occurs almost universally. Most people, their bone density peaks in their late 20s, early 30s, and then as they age, it decreases gradually. In men, you have a gradual decrease year by year, just a tiny little decrease. In women, you have a gradual decrease every year until they hit menopause, and then it goes whoop, and it drops rather dramatically. By the time they're 80 years old, both men and women have almost always have some degree of osteoporosis, meaning their bones are thinner and more brittle than they were when they were younger. Kidney function decreases as people get older. The kidneys are less efficient. Not just gastric motility, but the entire intestinal tract is less efficient and runs more slowly as people get older. And perhaps the most common manifestation of that is constipation. The lungs become less efficient as you get older, as does your nerve conduction is slower as people age. So basically everything begins to get a little less efficient as people age. And that means that if they get any type of illness, they have fewer reserves to draw upon. If we think about some aspects of nursing care in the aging, orientation is very important. You'll note that calendars and clocks are present in most hospital rooms and should be present in rooms and long-term care facilities. It's important that we provide consistency of personnel and routines. Patients will do much better if there is consistency. It's all right to let patients talk about the past. It's important for older people to realize that their life has had some meaning, that they've contributed something to the world. It's okay to talk about the past. We'd a little rather they didn't live there, however. Now, I thought I'd take just a moment and talk about some of the facilities in which we have provide care for aging patients. In retirement homes, we have people who may be relatively well, although they often have chronic diseases, diabetes or heart disease, high blood pressure, for instance. There's very apt to be a clinic or some type of facility, and often a nurse is present who may assist in acute illnesses and may also help with management of chronic illnesses. Patients in retirement homes usually are responsible for their own medications. In many of these places, they actually can leave anytime they want and go on a trip and then come back. Assisted living requires more care, and these are people that usually have been unable to live by themselves at home, so they can't cook their meals anymore and take care of themselves completely. However, usually there's a requirement for assisted living that they can get to meals and feed themselves so that They may need walkers, they may need canes, they may need little go-karts, but they get to a meal and they can feed themselves. They can toilet themselves, but they may need assistance with bathing, so they may need assistance with their showers a couple times a week. In a nursing home, they cannot perform their self-care, so they need more assistance. They usually have toileting issues, they may have orientation issues. In skilled care units in nursing homes look very much like medical units in hospitals, so we may be doing a lot of treatment for these patients. Many of the patients are elderly in nursing homes, but not all. You might find some patients there who had chronic illnesses like multiple sclerosis, who have gotten to the point where they can no longer care for themselves. And then there's an option of senior day care. In senior day care, you have patients, or I should say persons, going for the day. This allows their children who may be employed to work outside the home and not worry that they're going to burn down the house when they try and cook lunch, for instance. So they go to daycare and they're cared for and they get socialization, they get a meal, they get a nap, and then they're picked up and come home. So it allows them to be able to live at home and get some supervision during the daytime. Let's do just a question or two. A 65-year-old admitted for a closed reduction of the right tibia says to the nurse, "I don't know what my problem is. I'm tired all the time. I guess it's just a sign I'm getting old." What is the best response for the nurse to make? Choice 1, 65 isn't that old. Perhaps you are bored. Choice 2, it's normal for someone your age to feel tired. You should take a nap during the day. Choice 3, it's not normal to be tired all the time. Have you been checked by your doctor recently? And choice 4, sounds like you might be depressed. Would you like the name of a psychiatrist? Now, if you take a look at that, you know immediately it's either answer 2 or 3, because it's either normal or it's not normal. This patient was admitted with a broken leg. It's not normal to be tired all the time, so you would choose answer number 3. And notice that the referral was to a physician, not to a psychiatrist. We remember physiology before psychology. You should practice a few questions related to aging because they may be included on your exam, because aging are the fastest growing segment of our population. And many of your patients in both acute and long-term care will be aging patients.